So as you know, the crash course would be 12 weeks and we are 3 months shy from the exam. So still a lot of time for us in-depth revision. It's not just quick revision time, it is an in-depth revision time. And that is why I emphasize that anybody who has taken the exam before or they are lacking with, one cluster, they made in 3 clusters, but could not do in 1 or 2 clusters, for them the crash course works best, because if you got 3 A's and or if you were late to join the full course, or if you just applied for the exam and you were not sure whether you will take the March examination, this is the right time to start the crash course. We are starting today, which is week 1, day 1 of the crash course. Of course, the full course now will start the week 11. So your now full course candidates are in week 11. So you have completed entire subjects subject wise, and you have done the weekly mock as well. Now for the coming weeks, you will be doing the revision part during the program, and we will continue with our ultimate advanced file. We're also halfway in our ultimate advanced file. The ultimate advanced file is the accumulation of all the latest examination questions that have been asked recently in the exams. The chances of them getting repeated are pretty high, but how much gets repeated really gets changed with every examination. Sometimes 60-70% gets repeated, but in the last September 24 exam, as we all saw, that majority of the questions were new and the newer parts of the syllabus were covered. So they were not just new questions, but also some of the syllabus was also new. Some of the policies that were asked were new, like in endo, combination, combined lesions, in operative also, the vertical root fractures and the crack roots, then pedo and ortho as well, the newer concepts, the community guidelines for pedo, the community, and for the ortho, the early identification of the aberrated eruption patterns. So we are seeing what are the new topics of syllabus, and we are covering that in our ultimate advanced file classes. Now, as you all know, you will be getting a lot, like your full course candidates, you will also get a drive link where you would get all the important files at one place for reviewing. So drive link will work on multiple platforms, multiple devices. Basically, it is not restricted to one device, whereas your app will be restricted to one device. So our main material link, which is the drive link, includes most important files and also includes the most important articles that you need to be doing. Because even if the examination questions still get repeated, when they're repeated, they change the questions every time. It is not that a repeat question is 100% repeat question in exam. That is why when we prepare at Winsport for ADC, we prepare for each variation. So whether you're a full course candidate or a crash course candidate, it doesn't matter when you started, we all are aiming for success. We all are giving 100%. The point is to be prepared for the variations, be prepared for the even slight nuances and slight keyword changes, which changes the entire answer for the exam question. So those changed concepts, changed keywords, and slightly different concepts, how are you going to apply in the examination? There are two most important ways of preparation. One is the question practice and one is the concept practice, right? The course entirely focuses on grooming you, on mentoring you on these two major important practicing. One is the SBQ practicing, where you would look at the question and do a retrograde preparation. That's what I call it. It's a retrograde preparation because you start with a question and then you go backwards to the concept and then prepare the concept related to the question. Is that correct? So one is a retrograde preparation of the question, examination questions, and preparing the entire concept around it. Now, other method of Winsport, how we prepare is the orthograde method. Orthograde is how we start with a concept and we get prepared for any unseen questions. So our retrograde method takes care of the examination questions, and our straightforward looking forward orthograde method works on the concepts and the syllabus by working on the articles, the guidelines, the CV classes, the special topic classes, the important article classes, trauma guidelines, VPT document guidelines. Those are our conceptual classes. And then we have our SBQ and question classes in the form of thousands and 1400s and Mega Master file and the Ultimate Advanced file. So these form two very important solid foundations for your preparation. First of all, number one takeaway point, is that clear for everyone? This is what you would be doing for the next 3 months. And this is your approach should be. If you are doing any one of it only, then it is not a complete preparation, right? If you're just focusing on SBQs, you are missing out to maybe 10%, 20%, whatever, or even up to 30%. We don't know how many new questions will be there. So you lose out your opportunity on that. And that's why our grades then, when they come to C, which is your near fail, that's what happens, because there are just few questions that you could not mark correctly because of those some foundational concepts that got left. Is that right? So everyone is with me. Everyone is going to prepare both retrograde and orthograde approach for the available questions and for the unseen questions, right? Now, when we approach like that, we are preparing questions and we are doing the concepts, the ODEL cases, right? I've given you the list of the chapters which are only required for ADC from ODEL. You don't have to do entire ODEL book. Only few chapters need to be done. And which are those? The list would be provided to you under the drive link. Similarly, the Mega Master file and the Ultimate Advanced file is our accumulation of the entire ADC SBQ database. And all those classes are provided to you. We are almost halfway into the Ultimate Advanced file. And we will be continuing every week on Wednesdays and Fridays. And we will be repeating the Ultimate Advanced file. So we are almost halfway into the Ultimate Advanced file. All the classes of till now Ultimate Advanced file, whatever the crash course candidates have missed, they will be provided to you on the app. So one thing that will become a very handy tool for you all would be this drive link. Every day you're coming here, you're doing your Mega Master self-assessment, your Ultimate Advanced file self-assessment. And as I told you a few minutes back, that with every subject, even the syllabus boundaries has been expanded this time in the September 24 exam. Is that right? The newer topics that I just mentioned, some of them I have also covered in the power sessions during our Monday public meets. And most of them, majority of them, we are already doing with the Ultimate Advanced file during our internal classes. So a lot of new implant concepts, a lot of new ortho concepts, endodontic concepts in ortho. There are latest guidelines also, not just the syllabus for ADC has expanded. Those topics actually are even newer to the dentistry. They are the recent researches. They are the recent guidelines. Like Australian guidelines for endodontics were just released, and they have started asking those in the exam. So what we are doing is we are collecting all the latest advances in dentistry as well, and then preparing them as well, because ADC is taking those as guidelines to ask you how prepared you are for general dentistry in an advanced environment, right? So all those latest topics that are coming in the exam, all the latest guidelines are under the latest articles folder. That is also available for the full course and also available for the crash course. So this includes almost 30 articles as of now, but this list keeps on expanding as we keep doing more and more newer Ultimate Advanced file questions, right? So the latest article so far is not a complete folder. It is an ever evolving and expanding folder where I'm adding every week all the latest articles related to the latest advancements, guidelines, especially Australian guidelines, which were asked in the exam, which are getting released now, whether it be your latest crack tooth management guidelines, whether it's your latest endodontic guidelines, whether it's your medical legal aspect in Australia for endodontics, whatever the latest concept is, whatever the latest guideline is, it is available here. And all the answers to the questions in exam are directly here. So this is a very, very valuable asset. As valuable it is for you to have any ultimate advanced file and mega master, which is the database. Equally important for you is the complete database for the latest concepts. Because ADC is not the exam which you can crack by just doing past examination paper. There might be other examination in dentistry worldwide which you may do like that, right? Which may not be very high difficulty level, but Australian Dental Council exam is not one of those. It requires an in-depth preparation for your part 1, for your part 2, especially OSCEs. When you're trying to summarize the information, you require the foundational knowledge of everything in your part 1. And even in your part 1, the questions are no more straightforward black and white. When you watch my Ultimate Advanced File classes, you will realize when I discuss each question, how I emphasize that these questions are shades of gray. That's how we joke about these in the class, that they are the shades of gray, and you have to find the accurate shade of gray that ADC wants you to know. So it is not an easy task, trust me, but it is also not impossible. It becomes impossible with such diligent preparation of doing the conceptual preparation by using the question, and also by preparing all these latest guidelines and articles with our CV classes. CV classes is clinical vignette classes, which I have prepared based on various clinical situations and then use different guidelines and articles from Australian resources to prepare those clinical situations that can get asked in exam. We have CV classes, we have similarly special topic classes, which also focuses on conceptual topics. Along with that, we have important article classes. Then you have your ODEL cases and TG to prepare. Crash course does not include the therapeutic guidelines and the ODEL classes. If you require those, then the full course would be the best choice for you to enroll for. But this is for those who have done TG and ODEL once from their side. They have in-depth preparation, but they are looking for actual high-value concepts that directly get fit in examination questions and make you find that exact shade of gray. How? With different keywords, you will create a provisional diagnosis. Based on that provisional diagnosis, what should be your investigation? That will help you answer all the information gathering cluster questions. Based on the investigations and then the findings that are available to you in the questions, what would be your diagnosis? That would be your diagnostic and management planning cluster. Along with that, there will be few questions based on the diagnosis, which will ask you, what would you plan to do for this patient? There are also the management planning cluster. So everything starts as a domino effect when you start reading the question and start putting the keywords together as a pieces of puzzle. They all fit together, and if you put even one piece differently, the outcome would be wrong, and every coming question starts falling as a domino effect. And we do not want that. We want every piece of the puzzle to fit accurately. All the keywords, how when they come together, make sure that you know what provisional diagnosis it will give you. What is the relevance and importance of medical history and the drug history? Therapeutic guidelines extremely comes handy, and we all know that, but it's easier said than done. Knowing and remembering all your TG concepts is a big task, and also immediately able to recollect all that information in examination and apply it is also a big task. What comes handy is when we start doing the ultimate advanced file, when we are doing it, I always keep TG open when the question and the concept applies, and I always keep showing you that these are your, concept given in TG which gets applied. When you get your ninja mocks, which The crash course will also get in December, January, and February, 3 of the mocks that are waiting for you. All of the mock examination questions have utilized all these little hidden concepts given in TG, and you will see and practice how you can apply those concepts in those questions. So you will see that I have read that in TG, but did you really remember to apply it during the mock examination question? That would be your true practice, right? So first of all, the first component would be to have all your files on one place, all your articles for self-study on one place. This is your drive link. Then comes your second component, which is your application, where you will watch all the webinars. So right now we are having sessions 4 times a week, in fact, which is on Monday, Wednesday, Friday, and Sunday. Monday, Wednesday, and Friday is the session taken by me. Sunday is a session taken by special tutors who are also ADC past candidates and Winsport alumni and 4A graders in their first attempt. So they have been taking from the last 2 months your support classes. What they do is they help you summarize and revise the subjects at the end of each week. So the revision classes are also going on every Sunday. And then 3 days a week, Monday, Wednesday, and Friday. Monday, we do our public sessions where I come and talk about any important topic which may get asked in the exam or have asked in the exam. And we study it from the article or the guideline directly. And I highlight and help you understand the concepts and show you the link between the article study and the application to the direct exam question, because that is a skill set, and that's what I teach you, how to use every article to apply to the examination question, right? Now, that was the drive part. The other thing that you will get as soon as you enroll would be the access to this web space or your app space, where you would get this is your dashboard, and you go to your view course under the in progress box. And under the view course, you will see the course contents, which are for the next, sorry, this is the part 1 full course. Yeah. So under the course content, you will see that you have the coming 11 weeks study plan given here that you have to watch from the app. So under every week, you will start going from week 1 and day 1. And every week, every day, there is a dedicated webinar waiting for you to be prepared, right? So you watch every day. There are about 3 or 4 sessions. Some days there are 3, some days there is only 1. My first intention is to get you caught up on the missed ultimate advanced file classes. So we have done till page number 104 till now. So your goal is to catch up with the missed ultimate advanced file classes and also simultaneously start with the Mega Master file. Mega Master and Ultimate file, they are the combination of the most recent, most valuable, and the actual exam scenarios. And practicing them in a retrograde manner, where I take each SBQ, break it down to the keywords, to the concept, medical history, drug history, and then bring the concepts from therapeutic guidelines, then the concept from ODEL cases if related, and the concepts from various Australian guidelines about that particular core concept that is asked, whatever core discipline of that SBQ is. By combining all this information together, we put the pieces together by learning to identify keywords, learning to identify medical histories and drug histories, and make sense of it. What is the relevance and how it affects our provisional diagnosis and the coming answers. Because that is the golden key to answer all the questions of all the clusters, whether it be your information gathering cluster, or it be your diagnosis and management planning, or your treatment evaluation when you actually execute the treatment that you plan, and the health promotion. All these 4 clusters are interconnected based on the fact that if you don't create a correct provisional diagnosis, all of them will fall like a domino effect because one is connected with the other. If you are already enrolled with me, you know what a crazy person I am when it comes to forming a correct provisional diagnosis. I get to my students' life if they are not making a correct provisional diagnosis. So in our ultimate advanced file classes, everybody knows I keep asking questions. It is a very interactive session, and anybody makes an incorrect provisional diagnosis, I go cuckoo. And I have to make sure that everybody gets it. Why the importance of making the correct provisional diagnosis is extremely crucial to crack this exam and get all the A's that you desire in all the four. None of the questions would be a guesswork if you learn the critical skills that Winspert teaches you. And that is not a one-day key that I can hand it over. It is a practice. It is something that you would learn and master over time. And I will be there every week with you to teach you to actually pinpoint where you're making a mistake so that immediately you can bring attention to that and start learning the correct way to think also. Anybody can teach you and give you the concept, but somebody who teaches you how to think correctly has done their job best. And that's what I try to do at Winspert. I don't want to give you or hand you the concepts. I don't want to hand over that. I do, but I want to do more. I want to teach you how to think and read a concept and then learn how to apply it to a question. That's when I believe I have done my job completely, not just by handing over this is the answer, this is the reference, all said and done. No, I have to make sure in my live classes that my students are also thinking correctly, thinking through and making a correct provisional diagnosis. So when they give me a wrong answer, I immediately point it out that why did you say that it was the other answer? What was the thought process so that's where the intervention is done. The moment a wrong concept starts taking form in your brain, we intervene and we change it with a correct concept. This kind of skill level that we develop at Winspert will not just keep you going with part one, but also keep you going for your part two and even later ahead in your continuing professional development. Right? So this is your entire weekly plan that you are supposed to do. There is an Excel variation also of this entire program. If you want to see all the weeks layout in front of you, that's how I like to see also, because the app every day you open, go to your day one, week one and just watch. But if you want to see the whole roadmap together, like I like to see, this is your entire roadmap. Can you all see that? So this is your entire roadmap ahead. You're focusing on ultimate advanced files. You're focusing on mega master files. You're focusing on all the important conceptual classes in the form of important article classes, CV classes, and special topic classes. Along with that, all the most important guidelines, the code of conduct, majority of your professionalism question get answered from that. Infection control guidelines, all the new ones, the latest 5th edition, we have covered it in the most beautiful way, in the most visualizing and discussing it how in real life we are doing it. So it will be so helpful for you to memorize all the infection control guideline concepts. Then along with that, there is traumatic guidelines that will be added for you here. So trauma guidelines will also be given. Then trauma guidelines cover all the latest guidelines for avulsion questions, the fractures, the extrusions, intrusions, complicated fractures. So all the latest trauma guidelines are also covered and provided as your classes. So this is your entire roadmap for preparation, right? And this Excel is translated on the app, and you don't have to look at this every time, but sometimes if you want to see, and if you see the beauty of it, on the app within these 11 weeks, I have added the ultimate advanced file. Mega Master and all these CV classes, special topic classes, and your these important article classes twice. So they have been already added twice to the program. So you're not worried about when you will revise. The program itself includes revision, right? So this is the big roadmap. This is where you would be actually binge watching entire ADC lectures here on this app. Now on this app, you will also have the quizzes which will be released. So the quizzes will be released now in December. You will have the Ninja Mock level 3 coming up. So which is for Crash Course, it would be level 3. For the full examination students, the full course students, they have taken the level 1 and 2 as well in the last 2 months. And then in January, you will have level 4, and Feb, you will have level 5. So 3 Ninja Mocks are coming your way. Along with that, the public mocks will also be there. And the most important grand mock, which is 56 new SBQs, unseen SBQs, and totally testing you on all the ODEL, all the TG, all the articles that there is. Because I make sure I don't leave a single article behind when I am preparing the grand mock. You will be tested for 2 days, and all the 280 questions would be there, divided in 4 sections. It would be an exhaustive practicing question examination. You would take it. We will conduct it somewhere in the February. So we will finish Ultimate Advanced File classes by then. You would also somewhat have revised those, and then you would take that grand mock to see where you stand. So that would be, again, very important tool for us to assess that how much preparation it is, and you will still be doing it roughly 1 month before the examination. So by learning from your mistakes in your grand mock, you will still have time to work on those mistakes so that they don't get repeated in exam. Everybody is getting the importance of doing the grand mock a month before. Why did I plan? Why am I taking such extra strenuous classes and making that point to finish the Ultimate Advanced File by the first week of Feb, so that you have next 5 weeks till examination, and you take a grand mock at least 3-4 weeks before examination, learn and analyze the mistakes that you made, and you still have time to work upon them, right? That makes complete sense, right? Now, under the resources section, you have your, you will have your drive link here, drive material, study material link for Crash Course, right? So because I am enrolled for all the 3 courses, so OSCE and everything is showing to me, but for you guys, when you would be only for Crash Course, only one link would be visible for you. Then under the document section, you would have our most valuable revision tools, which you will start using most predominantly in the last 2 months before exam. So somewhere around mid-January, I would recommend that you get totally into these, which is your power notes and your hot notes. Power notes are the notes and summarization of the important concepts that you apply during the Ultimate Advanced File, because I understand that you can't continue to watch and revise the files just from the webinars. You will watch it once, twice, and maybe thrice in the first 3 months, but then in the January mid after, you would require to do it from some notes and a written material text. So this is your place where you would get, all the subject-wise Ultimate Advanced File questions, and which are summarized and the concepts revised there. So you can simply go and start reading those power notes for your 3rd or the 4th revision of Ultimate Advanced File. All the pedo-ortho questions, first the question is given, whichever SBQ was there. So entire Ultimate Advanced File class is covered. These are not transcripts of the class. These are not word for word, but these are actually your visual preparation tool, revision tool, all the concepts that apply, not just the ruling out method, but also a quick revision of the concept. So behind, like after every point, the explanation why you rule out what concept applies. So power notes will be your most powerful revision tool before the examination. These are part of both crash course and full course. Along with that, you also have your hot notes. So hot notes are your subject revision. Again, as I told you, Winspert prepares you not just for questions, it also prepares you for concepts and the ADC relevant advanced theory. Not your basic undergrad level of dentistry concepts are not asked. They are asked in the most advanced way. Of course, your basic foundation should be very clear. That is why we do the thousands and the past papers, because they are the ABCs to form the complex sentences in ADC. But the hot notes, again, in the last 2 months, are the accumulation of all the latest articles, all the latest guidelines, and they will help you prepare the topics in the last few weeks quickly at your device. So you, whatever registered device you would have, after you have watched the ultimate advanced 5 classes 2 times or 3 times max, the fourth and the fifth revision of the theory of the articles would be done from the hot notes and power notes. So hot notes and power notes are your revision tools. They don't replace your full-fledged in-depth preparation. They don't replace watching the webinars. They only, because every resource requires 5 times revision. So hot notes and power notes can be the fourth and the fifth time for ultimate advanced file classes and your article revisions. Clear for everyone? So this is how you will utilize your hot notes, where all the staging grading, smoking cessation, all the hot topics that keep getting repeatedly asked in the exam are at one place to give you the visual aid, all the concepts related to that, what are the important keywords related to that, what are the diagnoses, what would be the different managements, how you will execute those treatments, and what should be the preventive health promotional concepts. All the 4 clusters of every topic are covered under these hot notes. This is the most valuable resource that you can ever expect in the ADC preparation environment. If there is one thing that completely gets you, because this is not any AI generated material, any textbook copy paste, this is a human effort to bring actually the actual exam related concepts together by finding hundreds and 200s. I have about 200 of articles now on my drive. The full course students, I am sure they curse me every day when they look at that subject wise accumulation of all the articles. But all, I take it because I know it's a hard medicine, but for their own good. But one thing that I try to do is, on each of the subject wise folder, I made sure every article and every learning piece on that goes into the hot notes. So that's my gift to them, because I know I have given them a hard task of such 200 articles, but also it is my job to then summarize it, make it into the bite-sized information, and put it into these individual subject-wise files. So once they have done all the articles, in the last 2 months, even if they read only articles once, even if you crash course candidates also do your prominent articles and latest articles once from the drive, after that second time, I will be 100% okay if you just do hot notes, because that's what I have done here. I have collected all the important guidelines, BPE scoring, the pictures, this, how to do the treatment planning after that with each score. Everything is at one place. And in the live classes also, we practice these concepts. I show you the references. So I make a concept go through and go from front of your eyes so many times, and I teach you that that by the end of the program, you would anyways absolutely memorize it, because my ultimate agenda is to repeat it frequently. Right? So how the perio and diabetes are linked, then obesity, because these are the latest syllabus, latest advancements, and keep getting asked in exam. So food impaction, localized periodontal problems, all these are your high yield, extremely highly most recent concepts of the examination, and they are given to you. So every subject keeps getting added on the document section, and that's how you're preparing it. Quizzes will come and they will be announced on the group when they are getting released. So you will always be announced and you can take that. You can take and send, and every student is expected to send me their scores, and we have one-on-one discussion about the scores, discussion about the mistakes that are going on and how to work upon them. So that's how organized and well planned every day is thought of, every step is thought of, everything that you will find on this app is a thought of feature. Webinar archive comes handy when you want to particularly revise a topic, a class, and you don't know where it would be on which week. And you can simply go, if you want to revise an ICG class, you simply type ICG here and you get all the ICG classes. So all your webinar archive would be used to search. Basically, it would be one place where you can search all the classes that you want to prepare that day. Right? Particularly any class that you want to go on. Then document section, then forum section is where I put the references of all the ultimate advanced file classes by page wise. So you can just go, and you were revising the ultimate advanced file. There was a, reference shared and you wanted to see and revise. You can go and click. The topic would be mentioned. The page number would be mentioned, and you will read what is that, which page it is on, what question it's related to, what sub question it is related to, and what is this reference trying to explain. So everything has been absolutely thought of and then put it here. So every feature in the app is again designed what you would be using every day for your seamless preparation. So based on this, I would summarize, and you will also get this weekly plan, just like the full course candidates have also received. You will also get this. So just to summarize now, you're focusing on 5 important pillars to prepare for this. You're doing daily classes from app, which I showed you. You're also doing daily 2 to 3 hours of self-studies, either using books or articles. And also now hot notes and power notes, they would be part of your self-study. Is that correct? You will also, along with that, continue to revise your live classes and your important guidelines. As I told you, the revision of the live classes is also added to your study plan on the app. Then along with that, daily on a 30 to 40-minute basis, or as much time as you get. This is for my part 1 candidates and crash course. Everyone, I'm repeating it. Please take out 30-40 minutes every day and start solving ultimate advanced file classes or mega master, and continue to assess your score and try reaching that 295% score at least. Every day self-assessment must start now. Even for my full candidates, I'm reassuring you, reminding you of this, that please continue to start, do and even start, if you haven't started yet, your daily self-assessment for Mega Master and Ultimate Advanced File. And then also you will take the mocks as and when they are released and required. If on a daily regular basis, you consistently give your time for these 5 important pillars, then success and it would be waiting for you easily. After the examination, the results would definitely be in your favor. But that requires a consistent, persistent effort. not just your persistence, but also daily doing required dedicated tasks with sincerity. So you persist and you also remain consistent with the amount of effort that is needed on a regular basis, and you will absolutely land it. There is no denial about that. So this PDF is also available on the crash course on a daily and a weekly basis, what you have to do. So you can keep it handy. It is your gentle reminder to how to continue to watch the daily classes, then everyday revisions, everyday revision of the live classes, everyday self-assessment, and taking the mocks whenever they are released. So it is your gentle reminder for your weekly study plan that you, along with your peers, are going to follow till examination. I would now be happy to take any questions that you have. I see, Claudia, you posted a question there. Live sessions are going to be on Monday, Wednesday, Friday, and Sunday for now, and they are happening at 8:30 p.m. Sydney time. And usually they go about 1.5 to 2 hours. So yeah, 2 hours more or less they can go to. Any more questions, guys? I hope it was elaborative. Absolutely, you can go to any subject core if you are feeling bored, because that happens. But usually with my program, I try to keep it very interactive. Even the classes you will feel are so interactive. I try my best that you don't lose interest. But if at all you do, as you have seen, that my program is very flexible and you can switch the weeks if you want to. Yes, Fatima, all the ultimate advanced file classes that were the live classes, right? From the beginning, week 1, the live classes are ultimate advanced file classes. We are done halfway. And from this week, you will start watching live from the halfway, but all the missed classes are available to you. As I showed you, let me show it to you again, Fatima, so you know on the Excel here. So till page number 104, we have done, right? That is why from the first week only, I have added daily 2 classes you will watch so that you are catching up with the missed classes. So in the next 3 weeks, mostly in the next 3 weeks, you would have been caught up with these missed classes, right? So that's the main idea behind it. And simultaneously, we will keep moving forward. But in the next 3 weeks, you will catch up with the missed classes as well. Okay. Along with that, you will also start studying Mega Master file. So more concepts will also start building with you. From 3rd week, I have added then, because Mega Master would be finished, then I've added the CV classes and special topics and important article classes. So then more and more concepts will start getting clearer to you. Okay. When you experience it, when you go through it, you will realize that it's the most wonderful way. How in a month you will see everything will start coming together. And in the past, if you have not made it in any cluster, immediately you will start seeing that what were your lackings in that particular cluster. All those lackings will start making sense to you, because when you start doing ultimate advanced file, and I have marked each question with individual cluster on ultimate advanced file, I have marked every question which cluster it belongs to. And when you start making mistakes, you will start seeing that yes, in my original and a previous knowledge base, I was choosing this answer. And then you'll start noticing a pattern that how in one or particular clusters you were making more and more mistakes. For the live sessions, crash course and full course, it's the same schedule. Yes, Claudia. So everyone, whether it's crash course or combined course, live classes, they will attend together. Only your study plans are different. More or less, your full course candidates are also on these study plans now, because they have done subject-wise thousands and past papers already now. I want you to do advanced and mega master on your own. No. Don't do that. They are advanced questions, Fatima. If you start doing that without forming your base, you can start forming wrong concepts. At this stage, I don't want that. Okay. I usually recommend my students to start when they're doing a full course, to start with maybe taking thousands and past papers to know how the basics are done or not, how well they are in their basics. That's all. The advanced questions, I don't want you to start forming ideas. You have to learn correct thinking. So better is to first learn the trick to solve those questions and then revise it. Rather than forming a wrong idea and unlearning it, start by learning the correct thing and then reinforcing it. Core reading articles is just read it once with your study partner, as I told you. Okay. And most of them are highlighted. So majority of them are highlighted. And the most important articles core are already in the CV classes, special topics, and important article classes. So if you're really worried and short on time, do these classes, but don't at all leave the latest article folder. You have to read latest article folder 2 times with your study buddies, and then with the hot notes you can revise them. Okay. Perio is there, operative is there, endo I will be releasing in another week. So by the end of another 2-3 weeks, at least 3-4 subjects more would be there by end of December only. So you have a lot of time. All the subjects are slowly coming and joining, but latest articles don't leave, and then CV and special topics and important articles are covering everything else. From the subject wise, majority of the importance are covered here. Okay. Only 2 folders which you can't leave at any cost is your ADA health policies and your latest article folder. Read every policy and also read every latest article. If you really have to, make sure that you can read only few and you're short on time. Now, special topics, CV and important article classes will take care of all the most important subject-wise articles. But for your self-study, your latest and ADA policies, make sure you're not leaving them behind. Okay. So, I think I answered most of the question. Course, Fatima's. And Claudia, yours also for the complete course also. Yes, everyone has the same live sessions, right? So yeah, if any more questions, please hit me. And if you are not planning to join any course yet, you're taking the exam in September, you can join us for the dual course, because we are still open, and we're taking in for September preparation also. September 25 course preparation are also joining us. So we have a dual course available, and that too on a discount right now. So you can message me on my WhatsApp and get the details for dual courses. Yes. So if you're planning September, we have a dual course with good offer going on right now, Claudia. So feel free to message me and I'll send that. If you're still planning to just do self-study, then please join our free course, which is our monthly mentorship. Dual courses you can join right now and continue till September exam. So do the program not just for 5 months, but maybe 8 months or 9 months based on when you join. Because a lot of candidates, they are short on time, Sham, right? So many of my candidates, especially I think women who are short on time and who are juggling the household chores and their kids also, they join for the double course. Instead of 5 months, they do more months with me. So there is a flexible payment available, and the discount is also available. So please message me if you want to know about the dual course, because we already have September 25 candidates with us. So make sure if you want to join early and get that advantage, because if you're only able to do 2 hours, 3 hours per day, then especially I recommend going for the dual course. Natalie, if you're starting Crash Course now, minimum 6 to 7 hours I would recommend. Before the exam, you can stretch it to 8 to 9 hours as well. Should. We have 3 options available. We have dual course, we have full course, which is 5 months. We also have Crash Course. So based on what are you looking for, message me on my WhatsApp and I'll tell you. Whether if you're preparing for September, that's dual course. If you're going for March, you have full course option and Crash Course option. So I'll give you that. One more thing I wanted to show you was, if you are still planning to go by your self-study route, then you can join us for our free monthly mentorship, which is Absolutely free. You get our app. You will get the link of the app also. Just join our Facebook group, and there you will get the link to download the app. Enroll for free. You will get the public mocks every month, and you will also get every week public sessions through this app. And there's also a free resource drive link available. So it is a good starting point if you're just starting your ADC journey and testing the waters. Start with our free mentorship program. And if you have already made up your mind whether for March or September, for March we have the full course and the crash course, and for September 25 we have the dual course option. Yes, Tanveer, you can message my team on Facebook page and they will provide you the link to download the app. And then here you will press enroll for free, and you would be on our free program. And you test the waters, you see the free classes, you check out our free public mocks. And then when you're ready and when you've decided when you're going for the examination, then you enroll for any particular course that suits your requirements, right? So this is how I would proceed myself if I were also starting my journey. Any more questions, please know that my team is on Facebook page and I am on my WhatsApp personal number. Both are available to you. Whatever you feel comfortable, you want to message me directly, I'll answer you. You want to talk to my team, they will be happily helping you on the Facebook page. So let on the crash course and the full course difference. Okay. Let me also show you that if it's quickly available. I have a picture which I usually send with my inquiries. So let me see if I can quickly make it. It's on my phone, but I can, if you can send me a message, I would share there. All right, give me a second. I'll quickly make some technological thing and make it appear on my laptop. Yep, it's here now. So let me share my screen. All right, so the difference between the crash course and full course is here. IELTS is not required for your part one examination, no. Not even for your part two. Basically, it's required after completing your part one and part two. After your part one and part two, your requirement for IELTS comes. All right, so the 1,000 classes, the weekly subject-wise mocks and TG quizzes, TG lectures and ODEL lectures, they are not included in the crash course. And the monthly ninja mocks, level 5, all the levels are available for the full course, but for crash course only 2 or 3 depending upon which month we started. But this time you get the 3 levels. Then all the CV classes, the special topic classes, infection control guideline classes. And in January, yes, you would be getting 4 new mocks also coming up, which is your infection control guideline mocks and X-ray mocks. So we are bringing 4 new mocks, X-ray mocks, as well as your infection guideline infection control guideline mocks. So both those 4 mocks also would be available for crash course and full course. 2-day full ADC style main mock or grand mock is also available. Power notes, hot notes, they're also available for both the courses. So these are not the part of the crash course, which is TG classes, ODEL classes, TG quizzes, weekly subject-wise mocks, and your thousands and past papers subject-wise basic classes. So they are not included in your crash course. All right, so any more questions, guys? The up till your page number 104, the catch up would be done by you, right? And they are already part of the plan. As I showed you on the app, right? They're already part of the plan. So you don't have to plan when you will do it. I've already put it under the yes rule. If you join me for the March full course, but you changed your mind and you're planning to go for September, on that discounted offer, I can tell you how to extend the course to the September. So you can message me. Google Drive is available, the link is available under the resources section of the app, Hermeet. So when you go to the resources section, the Google Drive link would be here and Apurva would have granted you access to that. Yes, I will give you that discount offer also, Zul. Just message me and I'll let you know the discounted extension fees. So for Wednesday class, as you would know what pages we are doing next, it would be from 105 to onwards. So either you can prepare it in advance or you should just focus on first completing your weekly study plan, which is watching the missed classes that you have missed till now, Navjot, and then attend the class and just, learn from that class. It is not mandate to prepare for my class because it's not just questionnaire. I don't ask you questions what you have prepared. First, I teach you during the live class. So I really don't want you to come prepared for it. I want you to learn from it and then revise it. I want you to focus on completing the study plan. Are there any more questions, guys? All right, thank you then. Then I'll see you on Wednesday. And if you have any more questions, please message me on WhatsApp and I'll be happy to take it there. Thank you so much, guys. Bye-bye. Bye-bye. Good night. Thank you.